Yeah, I think that's the number one thing producers can do is to be aware, right? And especially if they've had pink eye in the past, they kind of get a feel for when that occurs in their herd and to be aware of when it starts. Because the number one thing you can do to reduce the impact of pink eye is to treat early and to really get those animals identified that need to be treated. Oftentimes, only the first signs you'll see is just kind of some excess tearing from the eye, maybe some more blinking. That animal kind of blink more than normal. And when you do start to see those, then you treat those animals promptly. And that's going to give you the most impact in reducing the amount of ulceration and mitigate any potential for blindness or other impact on those calves.
My general blanket recommendation starts with what we have that is legally approved and licensed for use against pink eye, which would include the tulathromycin and oxytetracycline. We also have some of the topical treatments.
We heard a lot of different opinions on various treatments, many of which are successful. And so I think what I took away is that whether I choose to do some sort of parenteral injection of antibiotics or whether I prefer to treat the eye with a local antibiotic, I think either can work. So it's dependent on the ability of the producer and the veterinarian to work out what's going to work for that system at that time. So that was encouraging to think that, well, all of these probably appear to work.